Type 2 diabetes is a disease where you can't regulate your blood sugar properly. When you have a meal or have something to drink, your body extracts the sugar from that, and the level of sugar in your blood goes up, and the way that your body regulates it is by releasing a hormone from your pancreas called insulin. And diabetes is when that insulin isn't working properly to regulate the blood sugar. Type 2 diabetes is where there's a combination of factors. Firstly, you're not producing as much insulin as you should, and secondly, your body is actively resisting the insulin that you do produce, and the combination of those two things means you can't control your blood sugar level properly, which is diabetes. Type 1 diabetes is when there's a complete failure of your pancreas to produce insulin. It's usually diagnosed in childhood because it's something that you have from birth. So you don't produce any insulin whatsoever. Whereas type 2 diabetes, you're still producing insulin. You have produced enough insulin for however long it's been until you've been diagnosed, but now you're not producing as much as you need to, and what you are producing is being resisted by your body. So the estimates are that around 5 to 6% of the world's population currently has diabetes, and that number has massively increased over the past sort of 10 or 20 years, and the major reason for that is the change in people's lifestyles. So the big things are people are a lot more overweight and obese than they used to be, and they do a lot less exercise, and those two things contribute heavily to your body's resistance to insulin. And because of that, diabetes has seen a surge over the last 10 or 20 years, not only in the number of people, but in the type of people. Diabetes used to be, we used to call it adult onset diabetes. It used to happen to people in their 50s and 60s, but we're seeing increasing numbers of young people with type 2 diabetes now as well. Insulin is a hormone produced by a gland in your abdomen called the pancreas. It sits sort of just underneath your stomach, really. It's released by the pancreas in response to your blood sugar levels. So when you eat something and your blood sugar goes up, the pancreas releases insulin, and the job of insulin is to convert that blood sugar into stored forms of sugar, and that reduces your blood sugar levels. Diabetes causes blindness because blood sugar levels affect your arteries. They affect the structural integrity of your arteries, and consequently they cause circulation problems. And when you have circulation problems in the vessels in your eye, that causes blindness. The classic signs of diabetes that really everyone knows about, that highlight it, are feeling thirsty all the time and passing large amounts of urine. So not only are you going to the toilet a lot, but each time you go you're passing a large amount. Those are the two classic symptoms, but diabetes can present in a wide variety of ways. Anything from feeling more tired than normal, not having any energy, to things like headaches, sweats, could be anything at all. Diabetes makes you pass urine more because your kidneys can't filter out the sugar in your blood. So what happens is the blood goes through your kidneys and gets filtered down into urine. But with so much sugar, the kidneys can't filter it out. So you get lots of sugar passing into the urine, and sugar brings water with it. So you get huge amounts of water being filtered out, so you pass lots of urine. When you pass lots of urine, you get dehydrated, and that's what makes you thirsty. So the diabetes causes the urine causes the thirst. To start with, diabetes is normally treated by making changes to your lifestyle. So, as we've said, the major contributory factor to diabetes is lifestyle. So the first line treatment is lifestyle, which means reducing your weight, increasing your exercise, and eating more healthily. Once those things aren't working, we move on to tablets, and there's a wide variety of tablets which are intended to both decrease your body's resistance to insulin and try and utilize the insulin that you are producing a bit better. Once you've gone through all of that, the last stage in treatment is what everyone knows, which is going on to insulin injections. There's nothing in particular you could just do at home. There's plenty of places where you can get a quick blood sugar test, like in lots of pharmacies, and usually at any kind of healthy events, fun runs, that kind of things. They usually always have people who are offering you quick blood sugar tests. They're not entirely accurate, so we'd always say to go and get it retested with a proper blood test at your own GP, and we always like to do at least 2 samples to confirm the diagnosis. It's preferable to do a fasting blood test, but nowadays we also use another blood test which tests your sugar control over the past 3 months. These days we tend to do a combination of those 2 tests. So it's always preferable to get a fasting sample, but you don't 100% have to have one nowadays to diagnose it. There is a genetic component to diabetes. There's no doubt that it's inherited. If your mother, father, or a sibling has diabetes, there is an increased chance that you will also have diabetes. Because of the world we live in nowadays, increasing numbers of young people and children are unfortunately obese, and consequently they're developing type 2 diabetes much younger because of their lifestyle. The good thing about diabetes is that if you're diagnosed early, and if you're committed to making some changes in your lifestyle, if you're committed to a healthy lifestyle, the combination of that and the medicines that we have nowadays means that actually your diabetes doesn't need to affect you in any way. You will probably not suffer any of the complications, and you won't even know on a day-to-day basis that you even have anything wrong with you. The important thing is that we diagnose things early and that you make a change in your own life.